Welcome to another episode of Youth Diary. Today we are going to discuss about obesity and its related problems. And to help us we have Dr. Mohammed Ismail with us. He is Chief Surgeon at Moulana Hospital, Perinthalmanna. Hello doctor, welcome to our show.
Hi.
So doctor, what is an obesity?
Obesity is a disease by which there is excess storage of the fat in your body. For every person there is an ideal body weight. The ideal body weight you can calculate by measuring the BMI, body mass index.
Okay.
See, the body mass index is nothing but just divide your weight in kilogram divided by your height in meter square. So the normal body weight is 18 to 23. The 18 is the lower measurement and the 23 is the highest. So if the body mass index is more than 23, that is abnormal. So if it is up to 30, we are calling it as an obesity. So if the body mass index is more than 30 or 32, that will produce diseases. Then we will call it as a morbid obese. So that is the staging of the obesity, and it depends on the BMI. We stage the morbid obese again, the grade 1, grade 2. I mean, if it is 30 to 40, it is the grade 1, and 40 to 50, like that it is and if it is above 60, then we call it as a super obese. So that is the measurement of the obesity. You can grade the obesity like that.
And doctor, what is the incidence of obesity in youth now?
Yeah, now the problem, the worldwide problem is the obesity, because the obesity presents a enormous burden on the healthcare system. In US and all, it is almost 33% of the patients are morbidly obese, which needs they need surgery. In India also, we thought it was less, but we found that the latest statistics shows that almost 7% of the patients in Indian population are obese. And I mean, when you take the number of the patient, it is huge, because when you take the 130 million people, the 10%, less than 10% is a huge number of the patients who are obese. And the more than that, we found that the adolescent obesity in India is increasing. That means, I mean, even though there is no correct statistics, the metro cities, our society, that is, I am an obesity surgeon, and we have got an association called Obesity Surgery Society of India, and we have conducted a study in the 4 metropolitan cities in the schools, and the results were really astonishing, in the sense that almost 25% of the school children in metro cities are obese. So the problem is that there, after 10 or 15 years, they are going to become the adult of our country, and so the obesity is definitely, it is increasing, and the incidence is almost 7 to 8% at present in India. And if you take the other countries like Kuwait, I believe the Kuwait, the latest study shows that only 12% of the patients are below 25 BMI. That means almost 88% of the population is above 25 BMI, other obese.
Okay. So is it because of the changing lifestyle, or?
Definitely. There is the why the patient become obese. Still the research is going on, but now there are more and more evidence suggests that previously we thought that it is just because that the patient is not doing the correct exercise, or they are eating too much. But now there are different science behind it, and recently we found that there is a course called Metabolic Allied Research Center, that is the USA, they are doing it, and now they have come out with lot of evidence with the help of the studies in the mice and the rats, that I mean, our body is just like an orchestra. So whatever the bad thing comes, our body has got the ability to resolve it or balance it. Like that, if you go to the cold, the body will preserve our heat. Similarly, or if you give blood, then within 48 hours the blood will recoup. Similarly, if somebody has eat more, the body has got a mechanism that it has to be balanced. So that is called a set point. Set point since there are multiple factors acting on it. From our brain, from the hormones, from the genetics things, and a lot of things are there. So when there is a imbalance in that system, some patients, I mean, whatever you eat, it comes. So we usually call it as, I mean, in the family, all our family members are obese, or I am getting obese. So definitely the genetic plays a role, but along with that there are a lot of the other factors there to you become obese. But in general, we can tell that it is the imbalance between your energy intake and energy output, because in a sense, I mean, for your daily activities you need an amount of energy. Suppose you call it as 1000. So in the food you are generating that energy. So if you take more than that, if that food produces almost 2000 or 2500 kilocalories of energy, that extra calories will turn as fat in your body.
The body keep it as a reserve.
Keep it as a reserve.
Okay,
so that is a, I mean, just a layman language, but there are a lot of the other factors also. Suppose you do a good exercise, that means, I mean, the muscle in our body has got a very good role in that. Previously I told that set point that it has got a very good role. So to do that role, you have to keep your muscles good. So you have to do good exercise or some sort of the exercise to keep your muscles good. Then even if you take more calories, that will be balanced.
Okay, right.
So whenever there is a alteration in the balance, the people becomes obese.
Okay. Are there any diseases associated with obesity?
A lot. Now the science of the medical science have proved that more than 65 diseases directly connected with the obesity. From the very common diabetes mellitus, hypertension, cardiac disease, varicose veins, psychiatry, there are 10 cancers. It is proved that 10 cancers in our body is directly connected with the obesity. From the carcinoma breast, carcinoma cervix. So obese patients definitely is having more these cancers. So these are called the comorbidities. So the obesity related diseases are, I mean, day by day the list of those diseases is increasing.
Okay.